Hi everyone. Let's talk about some pre and post-op medication considerations. So pre-op, we want to take note of certain things. We want to take note of whether or not they've had VTE prophylaxis, whether that be sequential compression devices on their calves or heparin, Lovenox, are they on any Coumadin? So all of those labs need to be taken into consideration and looked at. If they have heparin or Lovenox or Coumadin on their MAR, then chances are you should not be giving that the morning of pre-op. If you have any questions, then call the doctor. But that makes sense, right? Because if we give heparin the morning of pre-op and their OR surgery is in the morning, then they're going to bleed more in surgery. Okay, and definitely when we're talking about Coumadin or Plavix, they're longer term. They have a um, longer half-life, and so we might have to delay surgery if you give them the medications before surgery. So just give the doctor a call if you're unsure and make sure you give them what they need. Antibiotics. Are they currently on antibiotics? Think about antibiotics because we're going to talk about the skip measure soon in the next slide, and that has to do with the VTE and antibiotics that are given. You want to make sure that the blood sugar is under control, 200 or less. And then you also want to consider any other medications that they might be taking in the morning, such as beta blockers, antihypertensive medications. We need to think about that because if they're going under general anesthesia decreases your blood pressure and your heart rate. And so then if you give these medications prior to surgery, the anesthesiologist will have a much harder time regulating their vital signs and keeping them safe. Now, one exception to that is a beta blocker. It's not really an exception, but it's something that you have to call about. Some physicians, just because of the comorbidities the patient might have, might still want them to take their beta blockers before surgery. So just make sure to call and make sure that the doctor approves or denies the beta blockers for the morning. Okay. So the skip measure, uh, a lot of prophylactic stuff going on here, and this is a core measure. A core measure is something that has been shown to decrease any adverse effects from a surgery or some adverse effects from a surgery and increase the positive outcomes for the patient. So one of them is the prophylactic use of antibiotics, which is given 1 hour prior to a surgical incision. This you don't know the surgical incision time, so the OR team will give you a call and you will collaborate with them and coordinate when the antibiotic is to be given. Sometimes you will give it before the patient leaves your room. It might be hanging as they're going to the OR. And sometimes the OR staff will say to, tube it down to them so they can give it down there. This prophylactic antibiotic, also then the last antibiotic for this prophylactic will be given within 24 hours post-op. Okay. These measures have to be pretty much followed to the T because it's a core measure, which means that it's a proven statistics. Also, they need some type of VTE prophylaxis pre-op, so pre-surgery, which will typically be the SCDs. For the few hours before they go to surgery, they might have had heparin the night before, which is fine because it has a very short half-life. But not medications like Coumadin or Plavix. Those are absolute no-nos before a surgery. In fact, they might even be stopped either a few days before surgery, or they might just give them like a vitamin K if their INR is high with the Coumadin in order to decrease their or increase their clotting time slightly before surgery. Otherwise, they would bleed too much on the table. We also need VTE prophylaxis post-op, and typically, again, this is the SCD, sequential stockings. However, depending on the surgery, you might actually get heparin as well post-op. That'll just be up to the provider, depending on what happened during the surgery. As we know, heparin and Lovenox is a better anticoagulant than the sequential devices. They just simply help with circulation. Okay, so post-op, again, we're going to make sure that we have some type of VTE prophylaxis on the MAR. We're going to monitor for signs and symptoms of a DVT, although typically these don't occur until much later, typically um, after they've gone home, unfortunately. Make sure to discontinue those antibiotics in time. The OR will call you and let you know what medications they had in the OR. That way you know what to monitor for. But we already know that you need to monitor for the effects of the general anesthesia, which be making sure that their blood pressure or their heart rate, if it is a slightly low from that anesthesia, still is slowly starting to increase. However, the post-op um, department makes sure that they are stable before coming back to the floor. Pain management doesn't necessarily kick in right away because they use an anesthetic when they're doing surgery to help numb the area. But make sure that you do have pain medications on the MAR for when they start feeling pain, if they start feeling pain. This could be anywhere from acetaminophen to Norco to morphine tablet, morphine IV, or a Dilaudid IV. And then nausea and vomiting. So hopefully this doesn't happen, but expect it. And if it does, then you'll be giving them Zofran. So your job is to make sure that all of these items are on the MAR so that if needed, you can use them.